Good day, ladies and gentlemen, and welcome to the early recognition of sepsis in the outpatient setting, the role of home health care for improved patients conference call. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer session, and instructions will follow at that time. If anyone should require operator assistance during the conference, you may press star, then 0 on your touch-tone telephone. As a reminder, this conference call is being recorded. I would now like to introduce your host for today's conference, Mr. Al Cardillo. You may begin.
Thank you, and good morning, all. I'm Al Cardillo, Executive Vice President of the Home Care Association of New York State. I'd like to welcome you to this third joint webinar conducted by IPRO and the Home Care Association of New York State on the HCA Home Care Screening Tool and Protocol for Early Sepsis Recognition and Intervention. I'm here today with Yves Bankart at IPRO. Yves is the project director for the Sepsis initiative that IPRO is conducting in conjunction with CMS. I would like to thank IPRO for once again graciously hosting the webinar. In addition, to indicate that IPRO is a very active participant in the Home Care Association of New York State, a member of the HCA Quality Committee, and a member of the work group that we created within the committee, which really led to the development of this tool. Today's webinar is the third in the sequence of 4 conducted by IPRO, HCA, and partners on this unique sepsis initiative. Today's webinar, next slide. So today's webinar will focus exclusively on the integration of the HCA sepsis tool within agencies' electronic health records, which is a key step in integrating the tool into an agency's standard clinical practice, as well as supporting the ability for tracking and reporting capability. So we in the last webinar, which was on October 30th, we introduced the issue of EHR integration. But it was really, in that webinar, it was more of an introduction, kind of talking about the broad issues associated with the integration of the tool in the EHRs. Today's session will really be a drill down into integration, and we have an outstanding faculty who I will introduce to you in a few moments, from 2 providers and 2 technology companies to walk you through their successful integration of the tool into the record. So today's session is really to provide that detailed explanation and guidance and illustration for you. Webinars 1 and 2 were conducted September 30th and October 20th and provided extensive background on sepsis as a health emergency, as well as detailed walkthroughs of the tool. Both of those webinars are really prerequisites for this webinar. Webinars 1 and 2 are recorded and are available at the link, next slide, and are available at the link that we have presented in this slide, and also they've been linked by the U.S. Centers for Disease Control and Prevention to their sepsis clinical page under education and training. And I think that that's a very strong validation of what we're doing here in New York, to have the CDC post not only our webinars but this initiative to their own clinical site. We can make this, and we'll make these recordings available to you following today's event, following the event. Next slide, please. So participation in all 4 webinars, including the planned 4th webinar, which will be on February 9th, will be required for use of the HCA tool when we officially release it. Next slide. I just want to review right now in a cursory way our plans for the availability of the sepsis tool. So HCA will make the tool available to agencies shortly following the February 9th webinar via a user agreement with the agencies. And the reason that we're waiting for all 4 webinars is because of the importance of what we feel is covering this preparatory ground for the ultimate use of the tool. And the user agreement is intended to facilitate quality through the trained and standardized use of the tool, adherence to the form of the tool, adherence to accompanying protocols, participation in data sharing, and several other criteria. So we'll outline those in more detail following the release of the tool and with the release of the tool. But again, the idea is to ensure that everyone is using the same tool in the same way, and I think duly informed to support its quality use and really to maximize the effectiveness of the tool in the clinical setting. The other thing very important is that it will be very important for us to continue to work together to track the outcomes associated with a tool, the processes associated therewith, and to use that as a feedback loop, not only for continuous improvement, but also to be able to demonstrate effectiveness and seek further support for what we're doing. Next slide, please. HCA and IPRO will also be announcing plans to further assist implementation through various support mechanisms. So whether it will be technical assistance, office hours, periodic statewide calls with users, creating a process for submitting and responding to questions, reporting on the data that's collected, and others. And again, there will be more to come about these plans in the next webinar and following the next webinar. Next slide, please. So we are very appreciative and privileged to have as featured presenters for today's webinar 2 agencies and their respective EHR company representatives. These agencies and companies have specifically piloted the tool's integration into their EHRs for purposes of testing and presenting to you. And they volunteered to describe their experience and provide their guidance today. The agencies have also been piloting the tool as part of the U.S. Centers for Medicare and Medicaid Services Sepsis project in New York State, which I mentioned earlier, IPRO is conducting. The pilot is being conducted in the broader Capital District region and in the Central New York region of the state. Next slide, please. So today's presenting agencies include EHR technology companies and faculty are for the VNA of Utica and home-based, home care home base will be Tammy Coop, who is the RN Education Supervisor for the Visiting Nurse Association of Utica and Oneida County. Amy Bowerman, who's the Director of Quality Improvement for the VNA of Utica and Oneida County. The Director of Patient Services for Senior Health Network, a member of the HCA Quality Committee, and the work group leader for sepsis under the HCA Quality Committee. And then we'll soon be joined by Chris O'Donnell, who's the Sales Account Executive for Home Care Home Base. They will be followed by representatives from the Eddy VNA and St. Peter's Partners, as well as Delta Health Technologies. And they will include Patrick Archambault, who is the Nurse and Director of Clinical Specialties for the Eddy VNA and St. Peter's Partners, Barbara Bureau, Assistant Director of IT Clinical Support for the Eddy VNA, and Julie Peterson, Product Sales Specialist Support for Delta Health Technologies. And so with that, and without further ado, I will turn the webinar over to Amy, Tammy, and Chris to present the integration of the tool for the VNA of Utica partnered with Home Care Home Base. Amy?
Good morning. Oh, there was the slide I was looking for. Recently, VNA of Utica and Oneida County went live with Home Care Home Base. One of the first requests we had from our clinicians was to please move the adult sepsis screening tool into Home Care Home Base, because once a clinician has an electronic EHR, they do not want to go back to paper. So we started working with Home Care Home Base and have been successful in building the sepsis screen tool into the clinician's tablet in Home Care Home Base. I would like to introduce to you now Tammy New. Tammy is our education supervisor to walk you through screen tool on a clinician's tablet. Next slide.
Good morning. This is the screen in Home Care Home Base that the clinicians see on their tablets when they access the physical assessment. The clinician touches the screen where it states the sepsis screening tool, and it will advance the screen to the adult sepsis screening tool questions. Once the tool is complete, the green check mark will appear in the box to indicate the screen has been completed. Next slide. This screen mirrors question number 1 on the sepsis screen tool. Please note that not all the enhancements that have been completed on the screen tool have been completed in the system due to time, but can and will be updated. The clinician chooses whether the patient has any signs and symptoms of infection or a source site of infection. By answering yes, touching the screen will indicate that the clinician has chosen yes and then advance to the next screen.
Next slide.
This screen provides the clinician a text box so they can document what their findings are as to why they feel the patient has an infection or a potential site for an infection. Once documented on the bottom of the screen, the clinician touches next to advance to the next screen.
Next slide.
The clinician has chosen urinary tract infection as the suspected site due to the Foley placement. The clinician will then touch next at the bottom to advance to the next screen.
Next slide.
This screen mirrors question number 2 for the sepsis screening tool. The clinician has indicated that the patient has only one systemic criteria, which is they have a fever. The clinician touches next to advance to the next screen.
Next slide.
This question mirrors question number 3 from the sepsis screen tool. The clinician is indicating that the patient is having kidney involvement. To advance to the next screen, the clinician touches next at the bottom.
Next slide.
This question is important because it is a summary question. The clinician has answered that they have not answered no to all the questions. If they had answered, the clinician could touch the history button on the bottom of the screen. Next slide. This is the history of what the clinician has answered. The clinician can review the answers and then touch close to return to the screen tool. Next slide. This screen mirrors the follow-up section in the sepsis screen tool. The clinician takes all of the data from the 3 questions and chooses the most appropriate follow-up for the patient. This patient has met criteria for MD notification. The clinician will then touch next to advance to the next screen. Next. This screen mirrors the interventions from the sepsis screen tool. The clinician has documented that the MD was notified, an antibiotic was ordered, and a follow-up visit will be completed within 24 hours. The clinician then advances to the next screen by touching the next button on the bottom. Next slide. This screen provides clinicians the ability to document findings and actions that are not in the list. Here the clinician documents that they have called, report to Dr. Stethoscope, report the patient's signs and symptoms, the MD ordered antibiotic therapy, and a follow-up nursing visit within 24 hours. Next screen. Here is the completed sepsis screen tool. This is the last screen that the clinician sees when the screen is completed. Next slide. This is a scenario number 2. It provides a different view of the screen tool. The first question mirrors question 1 in the sepsis screen tool. Does the patient have an infection or a potential source site of infection? The clinician has answered no. Next slide. This slide mirrors question number 2 in the sepsis screening tool. Does the patient have 2 or more systemic criteria present? The clinician has answered none of the systemic criteria is present. Next slide. This screen mirrors question number 3 in the sepsis screen tool. Does the patient have a new onset of organ dysfunction criteria? The clinician has answered no new sepsis-related organ dysfunction present. Next. This screen summarizes the 3 questions. The clinician answered no to all 3 of the questions. Next slide. This screen tells the clinician, just as the sepsis tool screen tool does, that the screen is completed for the visit. Note that the follow-up and interventions did not come up because the answers were all no. It is very important that when you are implementing the sepsis screen tool into an EMR, that it mirrors the tool and is not altered to not obtain the data to determine sepsis criteria. Next slide. Next slide. Any questions?
Moderator, if you were on, could you please prompt our participants if there are any questions and allow the lines to be unmuted to pose a question.
Ladies and gentlemen, if you have a question at this time, please press star, then 1 on your touch-tone telephone. If your question has been answered or you wish to remove yourself from the queue, please press the pound key. One moment for questions. And our first question comes from the line of Catherine Coogan. With Allied Home Care, your line is now open.
So my question is, how difficult this seems to be a fairly simple tool from the integration point of view. Many of us have, there's so many different applications for the home care. How difficult was it to get this integrated?